Good day everyone. So today we're going to tackle about gene therapy. So what is gene therapy? So it is the introduction of genes into existing cells to prevent or cure a wide range of disease. It is a technique for correcting defective genes responsible for disease development. So yung unang naka-aproba or naka-experiment ng gene therapy ay si Ashanti De Salva in US on September 14 in 1990. And we have here the two types of gene therapy. First, somatic cell gene therapy, and the second, germline gene therapy. So, unahin natin yung somatic cell gene therapy. Therapeutic genes transferred into the somatic cells. Egg introduce of genes into bone marrow cells, blood cells, skin cells, and etc. We will be not inherited later generations. At present, all researchers directed to correct genetic defects in somatic cells. So, while the germline gene therapy, therapeutic genes transferred into germ cells. So, magkakaiba sila. The egg genes introduced into eggs and sperms. So, it is heritable and passed on to later generations. For safely, ethical, and technical reasons, it is not being attempted at present. So we have here the two approaches in gene therapy, which is in vivo gene therapy and ex vivo gene therapy. So for any type of gene therapy to work, genetic material first needs to get inside the cells of the person living with the disease. So this can happen in one way or two ways. So genetic material can be delivered to target cells that remain inside the person's body. So that we call it in vivo. Genetic material can be delivered to a person's cells after they are taken out of their body, so that we call it ex vivo. So ito yung nagagawa ng ex vivo gene therapy. Isolate cells with genetic defect from a patient, grow the cells in culture, introduce that therapeutic genes, select genetically corrected cells, and grow. Transplant the modified cells to the patient.
Example of ex vivo gene therapy. First, gene therapy to correct deficiency of enzyme adenosine deaminase or ADA. Means of adenosine deaminase or ADA is an enzyme of the purine metabolism which catalyzes the irreversible deamination of adenosine and deoxyribonucleic to inosine and deoxyribonucleic respectively, and then performed on 4-year-old girl Ashanti De Salva who was suffering from ECID, severe combined immunodeficiency, caused due to defect in gene coding for ADA. Deoxyadenosine accumulate and destroys T lymphocytes, disrupts immunity, suffer from infectious diseases, and die at young age. In vivo gene therapy, direct delivery of therapeutic gene into target cell into patient's body and then carried out by viral or non-viral vector systems. It can be the only possible option in the patients where individual cells cannot be cultured into vitro on insufficient numbers of brain cells. In vivo gene transfer is necessary when cultured cells cannot be reimplanted in patients effectively. Example of in vivo gene therapy. In patients with cystic fibrosis, a protein called cystic fibrosis transmembrane regulator or CFTR is absent due to a gene defect. In the absence of CFTR, chloride ions concentrate within the cells and it draws water from surrounding. This leads to the accumulation of sticky mucus in respiratory tract and lungs, treated by in vivo replacement of defective gene by adenovirus vector, like normal human gene gland in bacterium, and the normal gene DNA sequence inserted into harmless virus or AAV, then virus drip into lung through a thin tube inserted in the nose, and then virus enters lung called nucleus, lung cell, the nucleus. Normal gene DNA sequence inserted into lung cell DNA by virus, and then cells now with normal genes functions normally. Vectors in gene therapy. To transfer the desired gene into a target cell, a carrier is required. Such vehicles of gene delivery are known as vectors. Two main classes, viral vectors and non-viral vectors.
Viral vectors. There are four types of viral vectors. First, the retrovirus vector system, adenovirus vector system, adeno-associated virus 6 vector, last herpes simple virus vector. Retrovirus vector system is the recombinant retroviruses have the ability to integrate into the host genome in a stable fashion. It can carry a DNA of sizes less than 3.4 gigabytes, replication defective virus particles, target cell dividing. Adenovirus vector system, adenovirus with the DNA genome goods vectors, target non-dividing human cell, common called adenovirus. Adeno-associated virus vector, it is a human virus that can integrate into chromosomes 19. It is a single-stranded, non-pathogenic small DNA virus. EEB enters host cell, becomes double-stranded and gets integrated into chromosome. Herpes simple virus vector, viruses which have naturally tendency to infect a particular type of cell. They infect and persist into nervous cells. Methods of gene delivery. Physical methods. Gene employs a high-pressure delivery system to shoot tissue with gold or tungsten particles that are coated with DNA. Microinjection, process of using a glass micropipette to insert microscopic substances into a single living cell, normally performed under a specialized optical microscope setup called a micromanipulator.
These are the disadvantages of gene therapy. So we all know that gene therapy can be life-saving for some people with specific medical conditions, but it's expensive and can cause side effects. The development of gene therapy is highly regulated by the FDA and National Institute of Health. So long-lasting therapy is not achieved by gene therapy. Due to rapid dividing of cells, benefits of gene therapy is short-lived. Immune response to the transferred gene stimulates a potential rest to gene therapy. Viruses used as vectors for gene transfer may cause toxicity, immune responses, and inflammatory reactions in the host. Disorders caused by defects in multiple genes cannot be treated effectively using gene therapy. Like there's unwanted immune system reaction. Your body's immune system may see the newly introduced viruses as intruders and attack them. Like for example, like targeting the wrong cells, infection caused by the virus, and possibility of causing a tumor. Advantages. Gene therapy has the potential to eliminate and prevent hereditary diseases such as cystic fibrosis, ADA, SCID, and etc. It is possible cure for heart disease, AIDS, and cancer. It gives someone born with a genetic disease a chance to life. It can be used to eradicate diseases from the future generations. So, theoretically, gene therapy is the permanent solution for genetic diseases. But it has several complexities. At its current stage, it is not accessible to most people due to its huge cost. A breakthrough may come anytime, and they may come when almost every disease will have a gene therapy. So gene therapy have the potential to revolutionize the practice of medicine. So it means the conclusions from these trials imply that gene therapy has the potential to cure numerous genetic diseases, and that the procedures appear to have minimal risk to the patient. But the efficiency of gene transfer in the expression of the corrective genes in the human patients is still very low. So now these are the recent developments of gene therapy. In a new gene therapy method developed by University of Florida in January 2012, researchers found treatment for a common form of blindness that strikes both youngsters and adults. A gene therapy called NLXP101 dramatically reduces movement impairment in Parkinson's patients, according to results of a phase 2 study published on March 2011 in the journal Lancet Neurology. That's all for today. Thank you for watching.
In the future.